Hi, my name is Betty Mullen and I work at the Cancer Center. Previous to working at the Cancer Center, I worked 37 years for an insurance company. Our office was going to relocate to Ohio, and I, of course, did not want to relocate because my family was here. So those of us that were not going to relocate, we were given the option to sit at our desk, look online, look at the newspapers to see if there were any jobs that we might be interested in. One caught my eye, and it was for the Cancer Center, and I said, oh, this will never work for me because I never worked at a hospital or a doctor's office. But I said, just for the heck of it, I'll apply. So in November of 2008, I was hired. And I really believe I was sent to this office for a reason. Shortly after starting working at the Cancer Center, I was diagnosed with cancer again. I had cancer in 1998. I had breast cancer. I was diagnosed in 2008 with cancer again, and how I was diagnosed is I was having pain in my back, and at the time I was under treatment at Delaware County Hospital for my breast cancer. And I had mentioned to my doctor that I was having this pain in my back, and he suggested that we do some testing. Lo and behold, we'd done some testing and cancer showed up. I had a fracture in my back from the tumor, and I had other spots throughout my body of the cancer. Needless to say, I was an emotional wreck. My family and I met with the doctor, who decided that after these studies, other testing might need to be done. And I had asked him if he would mind if I went to the Cancer Center for my treatment since I was working there. And he said absolutely not. In fact, he knew of a good doctor there, Dr. Hewitt. So I met with Dr. Hewitt. I had known her from being around the office because I did work for a little while before getting sick. So I talked to her, and she said of course she'd be glad to take me on as a patient. We'd done some studies, and she said I would need a bone scan to see what type of cancer I had. And I had heard terrible, nasty things about having bone marrow done. So I was petrified. But knowing the type of people that I heard the Cancer Center had, the co-workers and all, I tried to put my fears aside but couldn't do it. The nurse practitioner that done my bone marrow, Joanne, was excellent. She said, "You're nervous, aren't you?" I said, "Of course." So she gave me something to relax me and asked me if I would like to have a nurse come in. I said yes. Nurse Kathy came in and she held my hand through the whole procedure. That was getting me on the roll to meeting the co-workers that I would be working with. Okay, Nurse Kathy held my hand through the whole procedure, and I was very grateful for her. And to my surprise, the bone marrow did not hurt. Joanne was excellent in doing her job. After that, it was diagnosed as non-Hodgkin's lymphoma. I would need chemotherapy and radiation again, and I was petrified. I didn't know whether I really wanted to do it or not because I was so sick in '98 when I had chemotherapy. But my family was standing by me. They wanted me to live. My son was in tears when we were diagnosed. My sister was there. She was in tears. And they said they would fight with me. So I elected to go through the treatment. Every one of the nurses at the Cancer Center, my co-workers, my bosses were excellent people. They stood by me, and to this day still stand by me. I come into the office, they say, "Hi Betty, how are you? You feeling okay?" And to me that's just precious. And the fact that they are so helpful, my family's there to support me. It's great to be alive now, and I couldn't do it without the support of all the staff at the Cancer Center. Everyone, all my bosses, my immediate boss, the head of the office, Sherry Kennedy, my co-workers, they're there for me from morning till night. All I have to do is pick up the phone and they're there, or go back and say, "Hey, you have a minute, I need to talk to you." What a group of people. They made me what I am today. They kept me alive, and I thank you for that.